Hello, hello. My name is Aaron Boone. I am the director of sales here at Cloudingo, and I think I have a special little treat for you folks today. But before I introduce my guest, if you're watching this video, I think you likely know who we are and what we do. But just in case, for those who don't, Cloudingo, what we do is help customers make the most of their Salesforce and Marketo data. We are certainly most well known in the space of deduplication or duplicate record identification and record cleanup. But of course, there's a lot of other aspects that go into data quality. And that is really the subject of today's call. Specifically, we want to focus and try to do some interviews with folks who we consider to be leaders in their respective spaces. And today's space is healthcare. Now, the guest I have for you today, Mr. Charles Cox, has been in this industry for quite a long time. Charles, why don't you say hi to everybody, and thanks again for taking the time to speak with me today.
Hi, Aaron. Glad to speak with you today. I've been in the healthcare business for over 40 plus years. It's a little bit long in the tooth of a career, but enjoyed every minute of it.
Well, I can imagine 40 years in a career. If it wasn't something you enjoyed getting up and doing, I imagine you probably would have stopped a long time ago.
That would be true.
All right, Charles. Well, listen, I want to make the best use of your time here, and for our audience, what I'm really looking forward to talking to you about today is really leaning on your expertise and understanding what you've seen in your career, what you think are current challenges in today's landscape from a data management perspective. And we're going to jump right in here with a question. So in this industry, maintaining accurate patient and operational data is very important. I don't think that that's too big of a stretch to say. And I think it's something that pretty much anybody in your shoes can agree with. So first off, I wanted to ask, what are some common data management mistakes you've seen organizations make in Salesforce specifically? And, how can that kind of thing be avoided?
Well, those are good questions. I've seen my share of different Salesforce environments and data related to Salesforce data management. And within that context, I feel that deduplication is almost mandatory. Your data management it has to be a mandatory responsibility there, especially in the healthcare market where it's so critical. If you're delivering patient care, if you're delivering bedside type of processes, it has to be exactly spot on every time for your members and your associates that are delivering care. Some of the issues that we've seen that I've dealt with in the past has been a lack of a great data architecture plan going forward. So as soon as you start to understand the Salesforce environment, you've got to have an overarching data architecture, because a lot of your Salesforce data is going to be integration related, whether it be with a billing system,
right,
whether it be with an insurance enrollment product. You have a lot of information that's going to be at the display layer of Salesforce. So it's got to be spot on for those consumers that are using the product.
So not only the kind of data that you have, but also understanding how that data is coming into the system, what happens to it when it does, and making sure that the people who are interacting with it know exactly, I guess for lack of a better term, can take that data when they get it and make operational decisions that they can be confident in.
Exactly. So most companies that I know will run reports, look at dashboards first thing in the morning. They'll have monthly operational reporting that they'll draw all the information from. And anytime you introduce integrations into another platform, you have to look at the timely delivery of all that data, right? And how long it takes to process it before it lands for consumption. So anything that you can introduce to make that more effective, time to market is huge.
I mean, I wonder, I can imagine how big of an undertaking that might seem to be. If I'm sitting down for the first time and really trying to wrap my head around this, coming up with that data architecture plan that you spoke about, where do you start?
So it is a $64,000 question, right? Most organizations, and thankfully for Salesforce, they begin with a concise data set for contact relationship management. So you already have out of the gate, you have objects within Salesforce that are predefined. So you can at least lean into that, plus the ability to have custom data fields there. But it's standard IT process to go back and look at requirements. What do you want to achieve with the data, right? And then from there, you can start to look at your key fields. Most large organizations have a universal key for a patient, a vendor, an insurance company. So some of the basic tenets there really do ground where your framework of data will move, not only from your integrations, but into Salesforce. And then a lot of people have business warehouses that benefit by data after it's within Salesforce and updated. So that has to be key critical, is understanding the connectivity between all of those. So back to requirements again. What do I want as my phase one? What I want as phase two? And then once you have that framework in place, you can start to really define what your data management's going to be around your deduplication efforts, your ability to make sure you have fresh data and not stale data.
Yep. Oh, there you go. You said the magic word, as you know, duplicate data. So I want to tighten the focus a little bit now and talk about duplicate records, and the specific challenges you think duplicate records cause for people in your industry.
Well, the first is that you have to absolutely be spot on if you're delivering member care. I need to know that the person in front of me and the person that's represented in the system, all data for that individual is absolutely correct.
Right.
With the healthcare core that is now in Salesforce, you're able to deliver at the bedside, in the physician's office, out in the field through mobile devices. So if I'm there to engage with that particular patient, I want my data to be spot on. So if it's not, I already have liabilities. And in the healthcare environment, you have certain government regulations, you have HIPAA data, PHI, that you're always working to improve meeting those compliance components, right? So if I have insurance data that I'm delivering and I can't get access to care because the data is not necessarily correct in my platform, I have problems delivering my core business. So that is absolutely key critical, especially in the health industry.
Can I ask you, I mean, I know you've been doing this for a really long time and you've been exposed to a lot of different environments. In your experience and in your career, how many times, or maybe that's not the right way to phrase it, but how often have you encountered orgs where that data quality just isn't where it needs to be? And I guess really where I'm going with that question is it always prevalent to some degree, across these orgs you've worked with? Is it hit or miss? I guess I just kind of want to understand what other people out there are experiencing, and I don't want them thinking that I'm the only person dealing with, because I got to imagine the healthcare data is just like pretty much any data set that I come across with when I talk to customers every day, regardless of what industry. There's always a level of duplicates to be addressed. And then I guess I just want to know, do you feel like that I'm kind of on the right track there?
Your master data management is not limited to any industry vertical, right? If you're in insurance, if you're in healthcare, if you're in marketing, and let's bring up a good challenge here that most people are going to deal with, which is I want to use my data as an outreach application, which is I think how Salesforce started. That's what Marketo was all built on, is the marketing aspect, right?
100%.
So think about how often the data, the core data around that particular contact or account is going to change, especially with phone numbers these days.
Yep.
Email addresses these days. You have a very mobile set of folks in the United States, especially these days, and they can pick up and go after 2 years. And so staying with that data, if you do purchasing of data lists for your marketing, how do you combine that into your current Salesforce platform and ensure that you have updated data, live, fresh data? Because if you're doing a mailing campaign and you send out 10,000 mailers, how much is that costing you per piece when you know you're going to get 15% of it back? Yep. If you have proper data management, you might be looking at 1 or 2% back. So, and that's just the nature of the game with people being so active and mobile and making changes all the time. So you can certainly reduce costs, reduce efforts with your data management capabilities. It's it's a given, and I'm sure in the Cloudingo world, you probably have benchmarks to show where data unmanaged versus data managed, there are multiple efficiencies in play.
We do. Can focus it down to industry and give you a score based on how you're doing compared to others in your same peer group, which we felt was important. But I want to hit on something that you just brought up as well, because I know there's a lot of people out there that feel like managing their duplicates is a one-time project versus something that they need to be doing actively. And I know that when I get on the phone with somebody and I'm talking to somebody, I'm very much trying to get them to see why this is a thing that they need to be on top of, not just once, but all the time. But I want to see if that's something you agree with, first and foremost. And I also want to get your opinion on why that's an important thing.
So wholeheartedly, I'm 100% in alignment that there is a cost of ownership and a responsibility to your data management, and that has to be ongoing each and every day. In some environments I've worked in, we've pulled in 5 million records, 5 million updates a day. If we don't have data management, we would be definitely behind the 8 ball trying to consume and manage to that. And you can see that on both sides of the house, both from an IT perspective and a business perspective, right? Because your business side of the house is going to be the one that consumes, and or your physicians or your nurses are going to be consuming this data, and they can see immediately when the data is incorrect or they have problems with it. So it has to be managed on a day-to-day. Data is a living and breathing part of your application set. So 100%. And so that gets back to the data architecture again, and why a tool or a process or a group of those processes is so important to understand. Can I process it all in a 24-hour period, or is it in real time? Some folks have data lakes where it's real-time updates and the data is applied there and it's bidirectional between Salesforce back to a data lake. Some are batch related that pull it in. I might get an update to, say, an NPI vendor list once a month, right? And so you will have multiple integration schedules, multiple integration points, and all of these streams have to play well together, which is always a concern, right? I have to keep that information in sync in some way, shape, or form.
Yeah, 100%. It is, I think, especially in the healthcare industry, I realize the unique nature, I think, of the importance of data quality because of two things that you've hit on consistently throughout this interview, which is that data not only has business and company implications, but it also has people implications. It absolutely impacts or can impact the type of care somebody is getting, and that's why I've always kind of felt like it's something that we don't get to kind of pat ourselves on the back on in very many industries, but healthcare, being that it is so two-sided in that way, I'm so glad to hear that somebody like you, somebody that has your experience and your wealth of knowledge, acknowledges that importance. And I just think that that's really cool.
Well, absolutely. I'm kind of old school that if you don't come to the table with the right tool, you can't build the right foundation for what else you want to move forward on. And definitely Salesforce is a great platform. I mean, it is so varied in what it can do and how it can deliver. But still, it's like every other application. The data quality, that stands alone, right?
Yeah.
So if I'm working in a healthcare delivery platform, if I'm working in an accounting platform, if I'm working in a marketing application, all of those things require consistent management of your data.
Okay. I mean, what I'm hearing from you is what I hoped I would hear from you, which is it really is a foundational square or piece of the puzzle when it comes to the overall, I guess, health, data health of an organization. It really does come.
Your service delivery. Yep. It's critical
to
your service delivery, no matter what industry you're in.
All right. I want to kind of turn in an eye towards the future. I know you're an old school guy. I think that's one of the reasons why I like talking to you initially all those years ago. Because I feel like even though I may not look it, my colleagues tell me I have old man tendencies. I don't exactly know if that's a compliment. I don't think it is, but I take it as one. I'm pretty good at taking insults as compliments. It's one of the things I've gotten good at over the years. But one thing that is not old school, and it is the flavor of the month and has been for, I'd say, at least a year, and looking to the future, these two letters seem to be all anyone talks about, and that is AI. One of the very core concepts of AI is obviously the data which that AI learns from and off of. It's been fascinating. I promise I'll stop talking, and because I want to hear your thoughts on this, but I have been fascinated to see two things. One, all of what it's already able to do. It has made go-to-market tools and processes so much more efficient. And I could talk about a tool we use over here called Sybil until I run out of words. And gosh, that's one tool and one example of something that we see a lot in our industry, which is AI taking data and allow those users to be so much more efficient with their time. But I want to hear what you think about what AI is going to do for the healthcare industry, and more specifically, how is it going to use the data that most healthcare providers have to do what you want it or hope for it or think is possible for it to do?
Well, first and foremost, in the healthcare industry, I think everybody wants an improvement in patient care. They want it cheaper, they want it faster, and from a patient perspective, if I'm a patient, I want it to be accurate. I want them to understand my proclivities as a patient coming to them. I want it to be utilized for me having to wait less time in the waiting room to see a physician, right? How does scheduling play into this? Healthcare has always been about scheduling, whether it's your resources or your patients, and how effectively can you see them? How effectively can you deliver patient care? And then what are your outcomes, right?
Yeah.
Have you succeeded in treating that patient today with whatever issue that they may have and done it effectively? And now I have history behind that. So when do I follow up? AI can help all of these trends. If I've seen, if I'm a family physician, what did it look like during the opening of the school season? How many children did I see that were all affected or infected, matter of fact, with a particular thing?
Right.
How can we ensure that we are scheduled next year for the same thing? The Matthew McConaughey thing. Type of commercial where he's sitting in the rain. It's like, how do I use it to benefit by looking at trends more in real time, understanding what future impacts can be, asking the question of AI to say, here's my past 3 years worth of results. Help me find trends, help me find cost savings, help me find better time to market, and help me improve what I'm driving at in our case, patient care delivery.
Right.
So I think it has a lot of potential. I also think it comes with a responsibility to ask the right questions of it. It's just like buying any other tool in a lot of different ways. I have to have a plan of what is my objective from this, and what is my return on investment towards this, because there aren't that many AI specialists out there, just like there's not a lot of big data folks out there either that know how to manage, to know how to shepherd, to bring about that return on your investment. So we're going to have to ask a lot more questions, I think, and really understand objectives there.
I think working backwards, just like you said, I think that's an important thought process to have in a lot of areas, not just data, but in life in general. But I loved when I saw it for the first time. It's Matthew McConaughey and it's Salesforce, and so I'm gonna automatically kind of smile or smirk a little bit. But the Wild West theme, I thought that was so nail on the head. Because there are a lot of people out there wanting to tell you how great their AI solution is for X, Y, and Z, but unless you have a plan and know where you want your end goal to be, the flavor of the month tool probably isn't going to be something that's going to get you there.
Sure,
it's a foundational understanding of your data and what you want to get out of it, as you've been talking to. Really this whole interview, and anyone that I've talked to on this topic understands that AI isn't a magic. It isn't the whatever, the red pill or the blue pill. I forget whatever the fantasy pill is from the Matrix. It learns. It can only learn and do the best job it can do based off the data that you give it and that you have. And that's why I've always kind of especially this last year, I think people are going to be thinking about the quality of their data more now than ever, because if they're going to leverage, AI tools, they want to feel good about the setting up that AI for success.
Absolutely.
Really.
And we'll get back to old school, but garbage in is garbage out. If you've not managed your data well, no matter what you ask of AI, it's going to give you some level of bad data in return. So these are all foundational components. If you're asked, AI is another analytical tool. Even if I were looking at 3 or 4 other analytical tools of the old schools, they're going to be making decisions based on the quality of the data that they have in front of them. So data must be pure, or to the level that it can be successful at what you want. And the only other thing here that I would say is it's an obligation, not only from an IT perspective, but from a business perspective. You need to have a business leader, a business champion, and also understand that the commitment isn't 3 weeks, and we've turned it on, and now magically everything is what I need it to be. It's an ongoing part of your organization, such
Yeah.
that you have a responsibility to raising it, to caring for it, and
Yep.
the care and feeding can be a year, it can be a 3-year plan, it may be a 5-year plan to help you move your
Yep.
your business from here to here and change the paradigm of how you deliver.
I see a part of the not so distant future where you have an AI officer whose best friend, or in this case, maybe worst enemy, I don't know, but is the chief data officer.
Sure.
Those those two working hand in hand to really make sure that they understand what they're delivering on in terms of the objectives of the organization as a whole. So I'm excited about it. I'm excited about the role that we as a data quality provider are going to get to play in what I see the future of business being, really.
Absolutely. It's an interesting space to be in, and from my personal experience, obviously, found that the tools and the customer service that Cloudingo provides helped us deliver on all of our objectives that we had, and doing so with a technology that helped that move effectively. And that's key critical. I've dealt with a lot of tools that have promised a lot, and in the end they can deliver, but it also took 3 weeks for them to deliver versus an hour. So that's also key critical, which I believe Cloudingo and the tools that are available there are absolutely top tier. So
I appreciate you saying that. You know that that means the world to me, and as well as this company. And Charles, I know you got a lot going on. So as we close here, I just really want to thank you for your time. We started this journey 10 years ago, you and I. It's been, I was looking back through our original statement of work from 2015 when we did that file import project, and never would I have thought that I'd be speaking to you again 10 years later about data quality and healthcare and
hey, listen,
AI.
it's still as important an objective as it was then. And here's the thing: you have a tool, you have a product. It's really the people behind that product that the value comes from. The engagements. 15 years ago, I'm still trying to remember back to yesterday. So 15 years is somewhat of a challenge occasionally, but it's the full complement. It's not just the tool; it is the hand holding, the discussions. It's the maturing of the processes there to make not only the business successful, but it all flow together very well. So, like I mentioned before, and you know this, a tool is a tool. It's the people behind the tool that make all the difference. And I've always found that Cloudingo is at the top tier of all of that. Tool's great, people are excellent. I mean, I noticed one of your coworkers passed by, still with the company, right? After all that time. It's still the core group of people making a great product and delivering great service. So you can't say that about a lot of the different tool sets that are out there any longer.
Well, we realize that, and we really try to make it a focus, and to know that comes through, and to know that that it did all those years ago, and that we still have a great relationship all these years later, means that it was genuine. And that's probably the biggest compliment that you can give the company is that aspect right there. So thank you very much for your time again. Like I said, I know you're a busy guy. I appreciate you talking to me. And Charles, we'll have to do something again like this, not in the near so distant future. Maybe not about data. Maybe we could talk about something more interesting like golf.
Thanks for your time, Aaron.
All right, Charles. Bye-bye.
Bye.